Hi, I'm Bethany Meyer.
Hi, I'm a
Nurse practitioner student at
Nice
Texas
to meet
State University. So what brings you in today?
I just got a new job and I need a physical.
Okay, do you have any complaints?
I have allergies and they're acting up right now.
Okay.
Other than that, I have back pain every now and then, but
When do you experience that?
I'm a nurse and so usually after a shift,
Okay.
I have back pain.
And what do you do to help relieve it?
Advil or just rest.
And that generally helps?
Generally.
Alright. So, did you take any current medications?
I do. I take birth control.
Okay. Daily?
Yes.
Okay. Any allergies?
No. No allergies.
Any history of tobacco use?
No.
No. Any history of alcohol?
Occasionally.
Okay.
If I go out with friends or, whatever, I'll have a drink or two.
Okay. Any other recreational drugs?
No.
No. Okay. I'm going to ask you some questions about your background, your childhood, and your history. Okay.
Okay.
So we can get all your information up to date.
Okay.
So as a child, did you have any illnesses or surgeries?
Just chicken pox. No
Okay.
surgeries.
Okay. And what about an adult? Any medical problems?
No medical problems other than the allergies that I take, like over the counter, Claritin or something
Okay.
occasionally. I've had, but no other like high blood pressure or anything like that.
Okay. What about surgical history? Any surgeries?
Yes, I've had 3 C-sections, and then I've had a breast augmentation.
Okay. So, your 3 kids, or 3 pregnancies with the 3
Yes.
C-sections?
Yes.
Okay. When was your age when did you have your first period?
13 or 12.
Okay.
12, I think.
And when was your last menstrual cycle?
Today is the 13th. It was the end of January, probably maybe like the 25th of January.
Okay. And are you sexually active? Are you married?
Yes.
You're sexually active with
Yes.
your partner? Any concerns about infection, sexually transmitted infections? No concerns there. Alright. How about your immunizations? Have you received your flu vaccine?
Yes.
Okay.
I
This
had
season?
in October.
Okay. Have you received a tetanus? Are you up to date on it?
I think I am, yes.
Okay. And when was your last pap smear?
October last year.
Last year? Alright. So tell me about your family history. Your mom and dad, are they both living?
They are. They're living. My mother has low thyroid. She has hypothyroid. She takes medication for that. She has high blood pressure
Okay.
that she takes medicine for. She takes medication for her cholesterol.
Okay.
I think that's it with her.
How old is she?
64.
Okay.
I think she's 64. And yeah, I think that's all.
Okay. Your dad?
He's 65. He takes medication for his thyroid also, and then for cholesterol.
Okay. Any other problems with him?
No.
Do you have any siblings?
I have one sister. She's living.
Okay. How old is she?
She is 44.
Okay.
She takes medication for her thyroid also.
That's it? Okay. And how old are your children?
I have a 13-year-old, 11, and 7.
And any medical history with them?
No, not anything. My oldest daughter had to have her tonsils and her adenoids taken out, and she's had tubes in her ears, but nothing big.
Okay. And tell me about your dad's parents.
Okay, my dad's parents, my grandmother, his mother, she died of, she had a tumor, brain tumor, and she died at the age of 64-ish, problems she had, but I just know that she had died from that brain tumor. Then my paternal grandfather, he had prostate cancer that metastasized to the bones, and that's how he died.
And how old was he?
70s, 72, early 70s, something like that.
And how about your mother's parents?
Okay, my mother's parents, my grandmother had, she was diabetic. She had hypertension and high cholesterol, and she's had a stroke before in the past.
Okay. She living?
No, she passed away. I think she was in her 60s as well, late 60s, something like that.
And how about
But my grandfather, he had, he was a big smoker, so he had emphysema and COPD, and I think he passed away from complications, like respiratory complications.
Okay. And how old was he?
I think he was probably 75 whenever he passed away.
Okay. Any family history of tuberculosis, anemia, any mental illnesses,
No.
kidney problems?
No.
No. All right. So, tell me, where were you born?
I was born in Seminole.
Okay. What is your highest education?
Have a bachelor's degree in nursing.
Okay. And are you currently working?
Yes.
What do you do?
I'm a nurse. Just work on the floor, resource rooms wherever they're short-staffed.
Okay. Do you exercise and diet, or
Yes.
have a healthy diet?
It could probably be better, but I do exercise.
All right. How often do you exercise?
Maybe 3 times a week.
Okay. Do you do your monthly breast self-examinations?
Probably not every month, but
Okay.
I do them occasionally.
All right. Well, I'm going to ask you several questions about your system. Answer yes or no, and stop me at any point if you feel like you need to explain anything, okay?
Okay.
Do you drink coffee or soda?
I'll have a Coke every now and then, maybe once, 2 Cokes a week, maybe. No coffee.
All right. Any weight changes recently? Weight gain or weight loss unexplained?
Not really.
No. Any recent weakness or fatigue?
No.
No. Any recent fevers?
No.
Any rashes or sores?
No.
No. Itching or changing your moles?
No.
No. Have you experienced any headache, dizziness, lightheadedness?
No.
No. Do you wear glasses or contacts?
No.
No.
Well, I have glasses that I wear if I need to at night,
Okay.
but I don't wear them all the time.
Any redness or double vision?
No.
Trouble hearing?
No.
Any ear pain or anything?
No.
So, nasal stuffiness and drainage?
Yes.
Experiencing that right now. Have you taken anything recently for that?
Not today, I haven't, but I usually take Claritin or Allegra.
Okay.
Yeah. I couldn't think of the name of it.
Any bleeding or any problems with your teeth or your gums?
No.
No. Any history of sore throat?
No.
Any pain or swelling in your neck? No. Trouble breathing?
Well, my nose is stopped up, yes, but normally no.
Any chest pain or shortness of breath when you're walking or exercising?
No.
Any heartburn?
No.
No. Any appetite change, increased hunger, decreased hunger?
No.
Any increase in thirst or decrease? No, no changes. Any swelling in your legs or feet that you've experienced? No. How about your bowel movements? Are those normal?
Yes.
When was your last bowel movement?
Today. This morning.
Alright. Any blood that you've noticed in your stools?
No.
Any trouble urinating or painful urination?
No.
Any history of cramps in your legs or experience anything? No. Any change of color in your fingertips?
No.
So you said you had some pain in your lower back. Is that the only time you experience is after
Usually.
work? Okay. Any history of hernias or are you experiencing a hernia?
I'm not, but you know, my dad did have, he had an inguinal hernia one time that he had to repair. I forgot about that.
So any sores or discharge from your vaginal area?
No.
No. Any muscle or joint pain?
No.
Are you experiencing like cold intolerance? Don't like the cold?
No.
Do you bleed or bruise easily?
No, not usually.
Have you ever received a blood transfusion?
No.
Any mood changes, mood swings?
No.
No. Any memory problems?
No.
No? Alright. Well, is there any other problems? I know you're here for a physical, so I'll get you time to change it to your gown and we'll get the physical assessment taken care of.
Okay.
Is there anything right now that I can help you
I
with?
can't think of anything.
Okay, well, we'll give you a couple minutes to change, alright?
Thank you.
Thank you.
Thanks.